Hello, so this is Guaifenesin and it is for your chesty cough. It reduces the thickness of your mucus, so it makes it easier for your mucus to be removed from airways. So the dose comes as a liquid. You can take 10 milliliter to 20 milliliter 8 hourly. So you can take maximum 3 doses in one day. Yeah, remember to separate it. Also, there can be side effects such as nausea and vomiting. It is rare, but if you develop symptoms of allergies such as swelling of the face, rash, then you should stop the medication and go see your doctor. So for the follow-ups, so most cough will go away on their own. However, if you have cough for more than 2 weeks, then you should go see a doctor. I would like to recommend the lifestyle management. Please get a lot of rest, drink a lot of water, get enough sleep to allow your body to fight off the infection. Avoid things that may trigger your throat, such as smoking, cold air, or dry air. Wash your hands more often, just to avoid the infection. As I have told you a lot of information, could you please give me feedback for one or two main things that I have just told you? This is the written information about guaifenesin for chesty cough, so please you can revise it when you go back home. Thank you.